the country doctor, Dr. James Christosik.
Good morning, everyone, and welcome to another edition of The Other Side of Medicine. I'm Dr. Christosik, the country doctor, and we'd like to welcome all of our listeners here this morning to the program. We have an exciting guest here in the studio this morning, and we'll be talking about him in just a few minutes. It's Dr. Papillo. He's a cardiologist, so if you have friends or family like to share some information about natural medicine and you'd like to have them get to the radio this morning, give them a call, let them know that we have a guest that's a cardiologist this morning. And we'd like to share with you some valuable tips on how you can help to prevent disease and how you can help to also treat things naturally. That's what this program is all about, natural medicine and preventive medicine. And also we're trying to help to bridge the gap between the traditional medicine of using the drugs and the surgery and using the natural medicine. And we're trying to see today if we can bring about a bridge between the two types of medicine, because, you know, one side doesn't want to hear what the other side has to hear. And so we're trying to come to have some kind of communication, a forum, ability to be able to help to educate each other so that we can learn and then be able to deliver better care to our patients. And that is what natural medicine is trying to achieve today, so that you and your family can optimize their health and prevent disease. So again, we'd like to welcome you to the program. If you're a first-time listener, we'd like to welcome you, but for those of you who are faithful listeners, we'd like to welcome you as well. Okay, well, let's get right now down to the business today of our guest, a personal friend and also a cardiologist, and Dr. Papillo is from Italy. And Dr. Papillo has a doctorate of medicine and surgery as well from the University of Rome Medical School. And he is the diplomat. He has a diplomat from the, you're going to have to help me on this one, Dr. Papillo. Is it the Liceo?
Yes, in Italian I would say Liceo, but it's the Liceo, it's fine,
okay.
Which is the undergraduate school in Italy.
Okay, so that, and then he has his Doctor of Medicine again from the University of Rome Medical School. He did his internship at the Rome University at the Polyclinic. Is that, am I saying?
Polyclinic.
Polyclinic, okay. And St. Vincent's Charity Hospital here in Cleveland also he did his internship, and the residency he did here at St. Vincent's Charity Hospital. So, Dr. Papillo, again, is background in cardiology and also in surgery and medicine. So we'd like to welcome you this morning to the program, Dr. Papillo, and it's a pleasure to have you here this morning.
Thank you, Dr. Christosik. Thank you for inviting me to your radio program.
Okay, well...
Good morning.
Yes, it is a good morning. It's Saturday morning, and it's 8 o'clock, and our eyes are still open. That's amazing.
Beautiful. It's beautiful to come downtown and not to see any traffic, so that was a change for me. And while you were just reviewing my young age, when I was young in Italy and so on, and the internship at St. Vincent, I was just reminding myself those times when I was doing rounds with then Dr. Zimmerman, we were looking at cholesterol, those times of 300, and not just it came to my mind while you were introducing me how times have changed. Of course, this may reveal my age, of course, but we used to look at cholesterol 300 and really not paying attention to it, because at those times cholesterol 300 was perfectly normal. And as you definitely know, surely know, that things have changed, and now we're looking at much lower numbers. So something has changed, and interesting is what is it that's changed? Because what is it that allows for the looking at a number and have a different reaction to it? Because again, many years ago 300 was normal. And now 200 is what we consider normal. So this is what I'd like maybe to share, to talk to you today, and invite people who are listening to call and create a sort of a dialogue with us. Thank you again for inviting me.
Sure, of course. We really enjoy having you here this morning. And the number to call and ask Dr. Papillo or myself questions is 578-1420. That's 578-1420. We have open lines today, and you can ask your questions, make comments if you'd like. And Dr. Papillo, you did make a very interesting comment. 300 used to be considered normal for cholesterol. So many years ago, that was considered normal. All of a sudden, now we've got 200 is considered normal for the adult.
Right.
So we're seeing a shift in changing in a parameter of a number here, but we're also seeing a shift in the thinking of medicine and the approach to healthcare. Could you give me a little bit of a background how you see things changing?
Yes.
The paradigm shift.
Sure. Certainly, because personally, I had a big change in my life, both personal and professional. And I actually feel a little bit privileged that I had the opportunity both to practice over in Europe, so to be very knowledgeable about the European system of medicine, and also to be many, many years now in the United States and practicing here. And there is, in my life and my professional life, has been a huge paradigm shift, and I'm very happy that this has happened because, I've been able to, I think, to contribute more as a physician in many aspects of the practice, not only to the biological aspect, but also to the social aspect, if you wish. What I like to say is that if I remember that, because I was trained as a pure technological biomedical cardiologist, so I've done a lot of work in pacemakers in my training and my professional life. I've done also the cardiac catheterizations, the angiograms that still, it's a very valid technique that we do today to visualize the coronary artery. Yet there was a time in my life when it had to do when I just came back from Italy and moved definitely back into the United States, where I started to realize that really if there had to be a major change and looking at the different research done, so the major change would have to happen just in the lifestyle, in the thinking, in the way of being in the world, and in the way of living. So I started retraining myself. In a sense, I started taking different seminars, classes, programs, reading a lot, and so on. And I had the opportunity to meet interesting and very significant people who contributed a lot to my professional development. And I looked into this issue of paradigm shift. And again,
let's just, for a minute, let's just talk about that word paradigm shift, because some people are going to get confused. Just for the ease of purpose here, paradigm shift just means a model. Paradigm is a model.
Yes, it's just the way we think. As I say, the way we think. In other words, if you go back, in history, like in the 12th century or so, the doctors of those times, they had a way of thinking which was very real for them. Like, you probably, if you dig around, you probably find skull with big holes and so on, because at those times when you were coughing or having temperature or having production of sputum and so on, the doctors of those times, they taught that you were invaded by evil spirits, for instance. That was real. There was a real, there were explanations, there were conferences there were meetings, and each one had his point of view. There were academic discussions and so on, but the reality was that you had evil spirits. And that was the 12th centuries. Now, if we look back, we realize that for the knowledge of today, that really, we can consider that ridiculous. But for the knowledge, for the thinking of those times, that was real. Today, what is real for us is what we know. What we know to explain, what we know to understand. We have the viruses, we have the bacteria, we have the biomedical thinking, we have the scientific explanations and so on. And which is perfectly all right, but it is only the way in which we think today. So
there's only one model.
The way we think is the model, is the predominant model of today. And the predominant model of today during and after the Industrial Revolution has been what we call the biomedical thinking. In other words, thinking in a certain way, reasoning in a certain way, which is not only true for the medical world, it's true also for our own life. In other words, we make an observation of something, the same thing when a scientist makes an observation, he observes something, and then we produce an hypothesis. We make an hypothesis, we want to explain what we observe, and then we make deductions out of the hypothesis, and then we look for another observer that agrees with us. And that's the way we go. That was just perfectly legitimate, perfectly normal. This is the way we live our ordinary life. However, This way of thinking has been very well when we went from the agricultural area into the industrial area. Now we're moving from an industrial area into what we call the information age. You know, the fax machines, the computers, the satellites, and so on. So the age is changing, and the thinking is changing along with the age changing. And it's the information age, a certain way of thinking, or being, of acting, which were very valid, maybe in the agricultural and industrial age, are no longer valid in the today's, are becoming, so that model of thinking is a bit cracking down. And that's why we're seeing this enormous revolution which is taking place in the health industry, and not only in this country, but all over the world. It's nobody's fault, or nobody's right, nobody's wrong. It's just that the thinking, the where we come from when we see our own reality is now changing.
And right now there's a lot of collaboration. There's a lot of discussion of different mindsets, of different ideas, old and new, coming together.
Yes.
I think that's what represents here today. But, you know, we're going to take a short break, and when we come back, we're going to discuss this some more about this model shift of this revolution that's taking place in medicine. And we're going to be back in a few minutes. And if you have questions and you'd like to call us, it's 578-1420. I'm Dr. Christosik along with Dr. Papillo, and we'll be right back after these short messages.
You're listening to The Other Side of Medicine. Once again, here's the country doctor, Dr. James Christosik.
Okay, welcome back, everyone, and you're listening live to The Other Side of Medicine. I'm Dr. Christosik. We have Dr. Papillo, a cardiologist, in our studio today. We're talking about the shift in the thinking in medical models today. People are changing their mindsets. Doctors are changing their mindset. We have an information age here, Dr. Papillo, and it's exciting. Let's continue on in the discussion about what you see as the future.
Yes, what is happening right now is that therefore a rethinking, a reorganizing of our way of looking at the scientific model. And of course the advent of computer and the technology of today is helping us a lot in doing that. What is happening is that a lot of the activity that used to take a long time to do, laboratory work and technology in the hospital, now done very quickly. The technology available, it's incredible. I mean, things that would take 2-3 days to do in lab work when I was a medical student, now it takes about 3 to 5 minutes. And a lot of inquiry about one lifestyles and so on can be done with the use of computers. So what is happening that there is a shift in basing the interaction between the physician and the patient solely on the measurement of parameters. Now we're going to other things. We're going about exchanging information. There is a larger request from people to have doctors who are very well grounded in their own knowledge and biological knowledge, but at the same time who know how to listen. Where there is an opportunity to be able to have a larger and longer interaction in the doctor office, so that people have the opportunity to examine many facets of their life, not only as a biological being, but also as a social being and a thinking being. And this is helping a lot because of course, disease are sometimes the reflection of problems in just living in life. And so there is a larger request from people of being treated not only as a biological being, but also as information processing system, if you wish. Yes.
Yeah, Dr. Papillo, people used to go to their doctors, and it was very, very passive. The doctor would give a prescription pad, and the patient would be very, very passive. The doctor would be just doing the active part. How do you see that changing?
Well, this is changing a lot. In other words, there is a change in the who's responsible, let's say. In other words, in the technological paradigm, the biomedical paradigm, the one where I practiced many, many years of my life, the primary responsibility was placed upon the physician. he or she was the one who had to do the research and find out and produce an explanation, and then point, the finger, if you wish, to the patient and say, this is what you need to do, this is what you don't need to do, you are missing this substance, you have replace them for you, or you have this growth, I'll remove it for you. In other words, the responsibility was primarily, if not totally, over the physician. Today, there is a change, there's a shift of responsibility, and there is a change of responsibility from the physician toward the patient, and a work in partnership. In other words, today there is more need of collaborating with physicians. Some things there is more need of communicating between physician and patient, and investigating many areas of life.
People are actually demanding that today. They want to take a more interactive part in their health care. They've seen that, over the years, that just sitting back and just taking the orders from the doctor and not asking any questions. As a matter of fact, I heard some interesting statistics lately that people who question their doctors, and people who argue with their doctors and ask questions, live longer. That's statistical.
Yes, not only that, but there are many other things which are surfing now in what allows for longevity. Now, in the biomedical paradigm, for instance, we have been spending billions and billions of dollars in trying to find out what is it that caused this disease and this breakdown and so on. We are not spending very much in what is in preventive medicine. I don't know if you're aware that out of the almost $1 trillion that we spend today, we spend less than 1% in prevention. And
that prevention, by the way, is not primary prevention. It's secondary. We're going to take early mammary gland, mammograms, and we're going to take breast exams. That's really secondary prevention. Primary prevention says, how do we prevent the breast cancer?
Yes.
By doing proper things in our lifestyle.
Yes, prevention is a very, it's a very, let's say, almost a mystical field, because everybody likes to talk about it, but it's difficult to put them into clinical application. Because prevention, like the word that says, as I say, prevenire, which means before it comes, is like almost handling something that is not present right now, and not let it happen. So it requires really a different way of being. For instance, they're finding out that people who live long, like you were mentioning before, in other words, we should spend more money studying those people, because it's something very interesting is surfacing out. For instance, those people who live in 100 years old, which Stanford say is what we expect to be. We should probably, our biological entities made to be 120, they say at Stanford at least, those people who live longer they live in a special way. In other words, we should spend some money in dedicate some research in finding out what is it about those people who live long, rather than spending this huge amount of money in finding out what allows for the breakdown.
Or looking for the magic pill.
Yeah. As a matter of fact, if you look at the technological aspect, we are the first place in the whole planet as far as bypass surgery and coronary angiography, ultrasound, MRIs, and everything. The technology is still, the United States is a leading country. But when you look at longevity, the United States is not at the first place. It's not at the second or third or fourth or fifth. It's at the 13th place. People in Albania live longer than here. So there is something else that needs to be addressed. And in my opinion, what it is the looking at ourselves not only as a biological entity, but also as the way we think, the way we live, the way we function as social beings.
Okay, we have a caller here, Dr. Phil. Let's see what's on the person's mind here. Good morning, and I'm going to have some help with this name here. Alejandro from Akron. Alejandro from Akron. How are you? Alejandro, good morning.
How are you today?
Excellent. What's on your mind this morning?
Okay, I do have a question along the cardiovascular line.
Okay, Dr. Phil is ready to answer that.
Okay, my grandmother, she's had like 3 heart attacks, okay? And I was just wondering what kind of natural medicines that she could take that could maybe help improve her as far as her breathing and her stamina, or what kind of things could she just basically do to improve her stamina, because she's the type of person that always likes to do something, and that's what has brought on at least the last one.
Okay.
Yes, first of all, if I understand correctly, she had already 3 heart attacks, myocardial infarction, or what we call them. So they usually leave a little bit of scarring in the heart, and sometimes also they are associated with some of the valvular problem. One of the heart valves may not work well. So I need to know a little bit more. But if she has problem in like shortness of breath or a little bit of swelling and so on, the first thing is to be very careful about the intake of sodium. In other words, how much salt is in our diet. Secondly, there are natural products that function as good diuretics. As a water medication. In other words, she needs to keep her blood volume in a very balanced way. In other words, the blood volume is the primary thing because, as you know, the heart is a pump. And what I would recommend to do, because there are many factors involved here. For instance, people who have had heart attacks, they may have also, they could be depressed a little bit. So then depression, of course, then accelerated the progression of the disease. So that also should be taken into consideration. I would not restrict the physical activity. I would do whatever is appropriate for her. And there is a product that I know which is a natural diuretic, which is called Wabana, which is a natural product that comes from watermelon. By the way, everybody knows that watermelon is a very natural diuretic. There are products that come from which contain a theophylline, which has a mild diuretic action too. I'm not very expert in herbal product, but if you ask your local herbal specialist, he may indicate it to you. In other words, we need a mild diuretic, anything that functions as a water, as increasing the elimination of water through the kidney is very good. Secondly, not to restrict the physical activity, but to be appropriate. Thirdly, peace of mind, because that's very important, because there is a decrease in cognitive function in people who have had a heart attack.
Okay, one other does pork play a factor in your heart?
I'm sorry, what did you say, pork?
Yeah, pork.
Yes, a very important factor because, as you know, the animal fat, and pork is very rich in saturated fat, is very important in the production of coronary artery disease, of arteriosclerosis. We need to change very much the way we're eating here because, you know, our major focus when we have a dinner is usually meat, is usually chicken, is usually roast beef, is something that has to do with meat, and around that we usually put some little bit of vegetables, a little bit of fruits. I think we need to shift that. We need to maybe be a little bit more like the Chinese people and look more into grains, into soluble fibers. So I would definitely decrease the saturated fat in the diet. We should bring the saturated fat as low as possible. We should quadruple the intake of soluble fibers, which are very important in the cleaning up, if you wish, of the artery, bringing the cholesterol
What are
out.
examples of soluble fibers?
Soluble fibers are very simple as grains. Okay, grains is a very good form of soluble fibers. I am very much in favor of using brown rice. Brown rice is really a king of food because it takes the cholesterol from the bile, from the gallbladder, if you wish, and carries out through the intestine. Legumes like beans are a very good form of soluble fibers, like black-eyed peas or lentils and so on. So like barley, grain, corn, those are all soluble fibers. Vegetable like salads and lettuce and greens and Swiss chard, so they're also very good, but those are not soluble fibers. Then, of course, you want to make sure that you take supplementation. You have antioxidants available, vitamin A, vitamin C, vitamin E, that you have enough calcium and magnesium. Magnesium and calcium and potassium are very important in people with cardiovascular disease, especially in regards to cardiac rhythm disorder. And people who have had a heart attack, very often they have cardiac rhythm disorder. The rhythm may not be regular. Now it's coming very strong coenzyme Q10 and also carnitine, very important for the prevention of cardiovascular disease. So it's a combination of physical activity, nutrition, and supplementation.
Okay, Thanks very much.
You're
Okay,
welcome.
we thank you for your call. We're going to have to take a short break, and then after these messages, we'll be back again with Dr. Papillo, a cardiologist, and I'm Dr. Christosik, and we can take your calls. It's 578-1420. It's 578-1420. We have about 15 minutes left in the program. We'll be right back.
Welcome back to The Other Side of Medicine. Once again, here's your host, the country doctor, Dr. James Christosik.
Welcome back, everyone. I'm Dr. Christosik, along with Dr. Papillo, a cardiologist this morning. And Dr. Papillo, you have been enlightening our audience this morning about the change in thinking in the models that we've created over the years and thinking in medicine, how it's shifting, people taking more responsibility for their health, doctors helping patients to realize they need to take more of an active role. People want to take more responsibility today. They want to get information about their health. They're interested. Many times doctors don't want to give them that information. They make the patient feel like they're ignorant. Patients today want information. They want to be able to access that information. And you've created a very interesting concept and a center. Could you tell us about what you've created in this InfoMed Center? We only have about 10 minutes left, so be careful here.
Yes, be fast. In other words, my problem was how to, having done this change within myself, was as a person, as a profession, how do I apply this new way of thinking into really practical terms? Within the due respect, of course, of the medical world where I belong to. And so I came up with the concept of screening, a place where people can walk in and learn about themselves. In 87, 88, and 89, we did a marketing research by bringing, of course, there was the time of cholesterol reduction and awareness about the danger of cholesterol. So we start doing screening in shopping centers and supermarkets and so on. And we find out that by asking questions that over 50% of the people encountered in the shopping malls did not have a personal relationship with a physician. I mean, that was astonishing to see that every other person did not have a doctor. And what I mean, they would go to the doctor in case of emergency, immediate care centers, emergency room, hospital, but they did not have a relationship with a physician like my doctor, like he used to be many years ago. Now, what we found the problem was, due to a factor of time, cost, and convenience. The way we were operating, and we're still operating a little bit, is too complicated as far as time, making appointments, waiting, and so on. And cost, of course, the cost of healthcare, which is astronomical today, and also convenience in the way the medical buildings are structured within the hospital campuses and so on. So I decided to create this center, which is called InfoMed Centers. It's, in other words, a place where people...
How do you spell that?
It's like the word informed, so InfoMed Centers. It's a word that combines both the word med as a medical and inform as information. It's a place where, right in the shopping strip, where people can walk in and will not see a physician, and the person can request a series of screenings or profiles or analysis. We have...
So what can a patient come in and get? I mean, what can they get when they come in? What kind of test?
Yeah, there is a sort of almost like a menu, and people can request cholesterol, sugar, anemia